Okay, that's cancer of the stomach, and later we can have a Q&A on that. What I'll do now, I'll talk a bit about cancer of the pancreas and the bile duct and how they manifest. This is also an area that's very, very important, and most laypersons have very vague ideas of cancers of the pancreas, which is also related to cancers of the bile duct and so on. I'm going to introduce you the concept of called jaundice. You look at this patient, the patient looks very yellow, and he is. Because jaundice is a condition where the eyes of the patient, the skin of the patient has turned yellow, and the reason the patient has turned yellow is because bile flow from the liver to the intestine has been obstructed. Now, there are various causes of that. There are medical causes, for example, hepatitis. Of course, there are also surgical causes. And when we talk about cancers, we're talking about surgical causes. How does jaundice happen in this instance? What are the causes of surgical jaundice? Now, I've told you earlier that bile is produced by the liver and flows down the bile duct. From the bile duct, it passes through the pancreas into the duodenum and of course into the intestine, where the bile juice helps in the digestion of food. Now, the flow of bile can be blocked anywhere along this path. If it's blocked right up here on top due to bile duct cancer, then of course you can get jaundice. It can be blocked lower down, for example, by stones and so on. Then you can get cancer as well. And of course, lower down, if there's a cancer of the pancreas around the head of the pancreas, then of course the flow of bile is also blocked and the patient can also get jaundice. So jaundice is a very, very important sign. Right? Now, where exactly is the pancreas, if you can remember? As I've said earlier, it's the organ behind the stomach. And if you remove the stomach, that's what you see. And it is intimately related to the duodenum. This explains to you why, if we were to carry out surgery for example, cancer of the pancreas here, a large part of many other things are removed. The pancreas, the duodenum, parts of the stomach, and the bile duct, because they're all so closely related to one another. So to be able to remove all the cancer cells, all these have to be taken out. So surgery for cancer of the pancreas is quite extensive surgery and quite specialized surgery. So this is a picture of a cancer in the head of the pancreas. As you can see, because of the location of the cancer, it has blocked the bile duct. And because it blocks the bile duct, the patient will manifest with, of course, jaundice, as I've said earlier. Right? So if the cancer is in the head of the pancreas, you can get jaundice. However, if the cancer is in the body or the tail of the pancreas is a long organ, if you can remember, then in this case, it's more unfortunate in a way because the patient does not present with jaundice, and usually by the time the patient feels the mass, it can be more advanced. And this is what happens when the tumor is in the body and tail of the pancreas. But wherever it is, pain is a very common symptom of cancer of the pancreas, and it's a very specific description. The patient will say the pain goes all the way to my back, and it's usually associated with loss of appetite and loss of weight. How do we diagnose that? There are many modalities. We can do a scope, including a scope with an ultrasound. But very importantly, is diagnosis through either a CT scan or an MRI. This, for example, a scan showing a tumor here blocking the pancreatic duct. So this is by far the most important way to diagnose cancer of the pancreas. Why do people get cancer of the pancreas? What are the types of cancers of the pancreas? There are two main types of cancers of the pancreas. The most common type is adenocarcinoma. So when a doctor or a patient say I've got cancer of the pancreas, usually he means adenocarcinoma. More uncommon are neuroendocrine cancers. These are more rare, sometimes associated with certain genetic conditions. So for the rest of my talk today, I'm going to focus more on adenocarcinoma of the stomach. There is no clearly proven risk factors. It may be related to smoking and some kinds of chemicals, but the association is not extremely strong. It tends to occur in patients who are older. By that I mean more than 50 years old. Of course, younger people can also get it. And again, life is not so fair. In this cancer, men also get it more than women, right? Of course, we can say that women get breast cancer and men don't. So of course, we balance out. Things are sometimes fair. So if a patient unfortunately gets cancer of the stomach, of the pancreas, how do we treat this patient? Again, because this is a solid organ cancer, if surgery can be performed, surgery is by far the most important treatment modality. But because, as I've said, it's in the middle of the body. Most of the patients with cancer of the pancreas are diagnosed not at an early stage. So less than 30% of pancreas with cancer of patients with cancer of the pancreas can actually undergo surgery. And of course, the surgery is very extensive, and the surgery is possible in specialized units where you get a team of surgeons trained to do that. And successful surgery can be followed by chemotherapy. There are new developments in chemotherapy that gives rise to very good agents that actually contributes to the patient's survival much more significantly today than in the past. Without surgery, survival is unfortunately not very long. If the surgery is not possible, then patient can be treated with a combination of chemotherapy or radiation therapy. Because of the location of the head of the pancreas, surgery is very extensive surgery. So this is the patient that had the Whipple's operation that I performed a while ago. So the tumor is here, right? But because of its deep location, the duodenum has to be taken out as well, and a part of the stomach has to be taken out as well, together with the bile duct and the gallbladder and so on. So very extensive surgery, after which the surgeon has to reconnect the different parts of the anatomy, the bile duct to the intestine, the stomach to the small intestine and so on, so that the patient continues to eat and have a normal life. So very extensive surgery and highly specialized surgery. But surgery is very important in this group of patients. It's with surgery that the patient can get the best possible outcome and survival. Cancers of the bile duct are in a way related to cancers of the pancreas because they present in the same way. Patient tends to get jaundice as well. So this is an image of a patient with cancer of the bile duct. Again, you see this part, that's where the cancer is, causing a blockage. That's why the patient was jaundice. And after operating, the surgery will actually require surgery of the liver as well. This is where the cancer is, causing a narrowing of the bile duct. Right? And unfortunately for us, cancers of the bile duct are much more common in Asia than in the Western world. So we are afflicted with this cancer more than, for example, our friends in the Western countries. The use of PET scan is a very important modality in the diagnosis and staging of patients with bile duct cancer. This is a patient with a PET scan, of course. This is a patient who presented with jaundice, and there is indeed a cancer in the bile duct. But this bile duct cancer sometimes has more than one location, and this is a peculiar feature of bile duct cancer. And when we did a PET scan, we realized that other than the tumor that is actually actively blocking the bile duct and causing jaundice, the patient has another location, another tumor in the gallbladder as well. And if we had not done the PET scan, we would have missed that. So as we did the surgery, during surgery, I could clearly see the tumor in the gallbladder as well. This confirms what the PET scan has shown. And when I cut everything out, you can see that this is the gallbladder. This is where the pancreas is, and the bile duct cancer was here. And there was also a cancer in the gallbladder. So accurate diagnosis and staging is very important, because otherwise we could actually do surgery that misses out cancers that is already in the body. Again, is there a way that we can prevent bile duct cancer and pancreatic cancer, and maybe detect pancreatic cancer earlier, since it's such a terrible cancer? Currently, unfortunately, we do not have very good ways to prevent pancreatic cancer. There are some families that have a particular predilection, but these are very rare occasions. So for most people, it's very difficult to be able to say that you can prevent pancreatic cancer. Is there a way to detect pancreatic cancer at an early stage? Again, because it's so deep inside the body, not particularly early. So for example, if a patient begins to get symptoms, imaging in the form of CT scan and MRI are very important if you want to pick up an early cancer. Of course, as the cancer becomes more advanced, patient becomes jaundice, becomes more clear. The early stages are particularly confusing and particularly challenging. But here is where scans and MRIs are very important. And usually the early cancers are picked up because the patients went for a scan for another reason, not particularly because of the pancreas. And in that case, early pancreatic cancers are sometimes picked up. And this is important for patient, because if it's early, then the patient can actually undergo surgery and be potentially cured of that. There are some blood tests that are useful, for example CA19-9, which is a serum marker, but unfortunately this is not very sensitive and not very specific, which is to say that a patient can have early pancreatic cancer and don't have an abnormal CA99. On the other hand, you can have an abnormal CA99. It doesn't necessarily mean that you've got cancer of the pancreas. So it's very tough to have early detection of this cancer. Right. So what are the recommendations with regards to cancers of the pancreas? All cases of jaundice or abdominal pain must be taken seriously, and you must see a specialist doctor in a hospital, because the investigations that are required to be carried out are usually carried out only in larger hospitals where the facilities are available. And if the patient is diagnosed at a relatively early stage, surgery is very important. So very important to tell patients that if you have this kind of symptoms of jaundice or unexplained abdominal pain, you should not delay. You should go and see a specialist doctor in a big hospital to get that diagnosed, or at least to let you know that you don't have this problem. So this is a very important take-home message. Okay.